let's go into the calibration. Let's go into it, or you can click setup if it's not fast enough. There you go. Let's just drop it like right in the middle, right here. Everywhere you have slices is where you'll get signal. Let's move that up. Okay, cool. Let's run that. Alright, let's go into that axial. Okay, so we're gonna scroll through here. Let's window it up and to the left. Perfect. And now we're gonna unclick update all. Okay, so what we want to look for are the beans. So you could actually see them right here. But if you can't find those, you can always go down. You can always look for Shrek instead. You have like Shrek's ears right here, which are the IACs, Shrek's head, shoulder, you know, and chest and stuff like that. This is what I call Shrek. You can see the IACs are the ears. So let's over here find Shrek's ears. Scroll the other way. Perfect. Right there. Up one. Perfect. Okay, so we're planning an axial, so we found the beans instead. Let's just drop it right in the middle. Perfect. Let's angle that a little bit to the left. Perfect. Now, we always want to cross-reference with over here. You can see this like big black space of air. That's the IACs, or internal auditory canals, with the vestibulocochlear nerve. We should be centered just beneath the level of the vestibulocochlear nerve, so you can see it right there, and that we're just below. Okay, so that looks good. Let's save this. Oh, I'm sorry, we have to click here. Acceleration, and drop down, we'll do 1. Perfect, save that. Scan. Now we're going to go into the coronal. I want you to find Shrek's ears over here. There you go. You could only see one of them right here, really. See the other one later on. Okay, and we're going to wait for our axial for now. So we do have time, we have like 2 minutes. In the meantime, let's just shorten up this current sequence a little bit. So let's click that arrow. We're gonna drop the next to 2 and the phase to 160. Don't do this in clinical practice. This is only because these are labs. And now we wait. So the beans that we're looking at, these guys right here, their real like anatomical name is the condyloid processes of the mandible. You could just call them the mandibular condyles. I call them the beans because that's kind of how they look. So we're going to look for those once we get this, and we're going to select series, bring it up down here, and then we'll look for the beans. Let's window it down to the right. So here you can see the beans very well. Those condyloid processes of the mandible. The coronoid processes would be like up here, right in here, give or take. right there. Okay, so this looks like an excellent image, so we're gonna drop our slices right here, right on the bean. Perfect. We're gonna angle with the bean. Perfect. Yeah, and let's angle the other one and maybe center it a little bit. Perfect. Let's angle it. And this overlap right here in the middle is going to cause crosstalk artifacts, so we want to separate these, we want to spread them out. Yes, exactly, so that reference line is on the outside of the bean. But also, let's kind of center this one, let's bring it down a little bit. Perfect. Same with that one, let's bring it down just a little bit. Perfect. Okay, so these look great. I like to reference over here. You can see that we're centered just underneath Shrek's ears or the IACs, so that looks good to me. Let's save that and scan. And now we're going to go into that sagittal, and we're going to do the same thing. We're going to pull up those IACs or Shrek's ears right there. Perfect. We didn't get great images for Shrek's ears, but I'll show you guys on the new Axial. So this is series 1 right here, meaning it's the localizer. So yeah, let's bring up the new Axial. Perfect. So I never showed you guys Shrek, so let's scroll down. I'll show you Shrek real quick. One more. There you go, there's Shrek. Kind of looks like a snail here, but you have like Shrek's head, his ears right here, which are the IACs. Yeah, there's like neck and shoulder. Bilaterally, so you can see like the ear. Shrek's ears are the IACs, and so I always kind of look for this image right here if you can't find the IA, or if you can't find the mandibular condyles, because you know that you're close if you can find this. So let's go up like 3 images. There you go, the beans. Let's go up one more maybe. Perfect. Okay, so now we're going to do the same thing. We're going to drop them right in the middle, and now we're going to angle with this reference line through the bean. Perfect, those mandibular condyles. Perfect. Over here we're good. Sometimes radiologists do want you to angle with the mandible, so scroll down. Let's go up, I guess. Yeah, might as well. A little bit more. Sometimes radiologists want you to kind of like angle with the ramus of the mandible, which will go down like that way. For now, just for simplicity's sake, we're going to keep it straight how it is. Again, we are referencing these are just barely below the level of Shrek's ears or those IACs, the vestibulocochlear nerve, so it looks good. Again, because it's not clinical practice, we're going to shorten these up. We'll do 1 and drop the phase. Okay, let's scan. And now we're going to go into the next one. We already planned a sagittal. We're just going to copy this one to that sagittal. And shorten it up again, the forbidden way. There we go. Let's save that, and let's throw it in auto scan for now. Now we're going to do the same thing for the remaining 2 sequences. Shorten it up. Perfect. Okay, let's move on to that final one. Shot that to 1. Perfect. Let's save that. And now that we're almost done with this one, and now it's starting the last open scan, we're going to take it off auto scan because we need a pause in between the closed and the open sequences. That way we can check in on our patient and tell them, hey, pop that roll or bite block, syringe, whatever you're using to prop their mouth open in their mouth. So now we wait. want you to turn up her a little bit, and now you're gonna tell her, pop that tape in her mouth, that roll in her mouth.
Okay, Haley, can you go ahead and bite down on that roll without moving your head and give me a thumbs up once you're done?
Perfect. Can I tell her to throw a thumbs up?
Hey, Haley, are you ready?
I saw her do it. Alright, you can scan. Yeah. Okay. Great job. So that's the TMJ. Once you're done scanning, you just have to make sure you check all of your images before you take your patient off the table and send them home.